we're going again. Hi, I'm Cora. I'll be your nurse for today. Washing my hands. Can you state your name and date of birth?
Brooklyn, February 29, 2004.
Do you know where you are?
The hospital.
And do you know what day it is?
April 23rd, 2020. Sorry.
That's pretty close. None of us know what day it is these days, so that's pretty good. She's alert and oriented ×3 to person, place, and time. She's dressed appropriately. She's sitting up straight, so she has good posture, and she looks like she has good nutrition, and she doesn't seem like she's in any acute distress. Now I'm going to take her vital signs, and I'm going to start with the 2-part blood pressure. So I actually have it on. You never could see it in the first place. Okay. So I got 115/50 for her blood pressure. Now I'm going to take her temperature orally. I actually already sanitized this, so... Her temperature is 98.2, so normal. Now I'm going to move on and take your radial pulse, and I'm going to count for a full minute. So I got 66 for her pulse. And now I'm going to move on to her respirations. I'm going to do this for a minute too. So I got 8. I actually only did it for 30 seconds, so her respirations would be 16. Okay. Now I'm moving on to skin, hair, and nails, and I'm going to put gloves on for this part. First, I'm going to assess the scalp and the hair. Okay. Does not seem to have any lesions or rashes or bumps. Her hair seems to be clean, and it's dyed, So, but it's normally brown. And her hair is symmetrical. It's evenly distributed throughout her head. And now I'm going to assess for skin turgor, which is right here. And it went down, so she's hydrated. Now I'm going to assess for capillary refill, which is in the fingers. And it went back, refilled in less than 2 seconds. So she has good circulation and she's hydrated. And I'm going to assess for clubbing at the profile view, which is normal, which is 160 degrees. And then and that is actually it. Next, we're moving on to the ears, and first I'm going to inspect the external ear for any bumps or lesions. None. And then I'm going to inspect the top of the ear with the eye to see if it's in line, which it is. So it's symmetrical on both sides. And now I'm going to move on to palpating, which I'm going to palpate the external ear, and let me know if you feel any pain. No?
No.
Okay, I'm going to do the other ear.
No.
Okay, no pain on palpation. And now I'm going to move on to the hearing test, which I'm going to whisper 3 words into this ear and hold the other ear and let me know if you hear them. Okay, so can you repeat them?
Dog, cat, unicorn.
Okay, I'm going to do the other ear.
Umbrella, frog.
Okay, she heard them, so she has good hearing in both of her ears. Okay, now we're moving on to the eyes. I put my gloves on already. So I'm going to inspect the external eye. There's no bumps, no leakage, no rashes. Her eyelashes are evenly distributed. Her eyebrows are evenly distributed. And now I'm going to move on to inspecting the scala and the conjunctiva. I'm going to pull down your lower eyelid. Okay, no signs of infection. The conjunctiva is clear. And now I'm going to test your extraocular movement. So if you could just follow the light with just your eyes, not your head. Her movement was smooth, doesn't seem to have any trouble, which is cranial nerves 3, 4, and 6. And now I'm going to assess her pupils. So before I turn the light off, her pupils are a 5. Now I'm going to turn the light off. And if you could look at my shoulder. Her pupils are equal and reactive to light, and they went back down to a 4. So now I'm moving on to the Snellen eye chart, which I posted on my door. And she's going to stand 20 feet back and read the lines. Could you cover your right eye and read with your left? Line 6.
E, D, F, C, Z, P.
Line 7.
F, E, L, O, P, Z, D.
8.
D, E, F, P, O, T, E, C.
And could you switch with your other eye? And line 8.
D, E, F, P, O, T, E, C.
So both of her eyes are 20/20. Okay. Now I'm moving on to the nose, and I'm going to start with inspecting the structure of the external nose. So it is in midline. There's no lesions, no bumps. And now I'm going to determine your patency of your nostrils. So I'm going to have you cover one nostril and breathe in. And cover the other nostril. So it seems like there's no obstructed airway and she can breathe normally. And that is it. Now moving on to the mouth and throat. And I have my gloves on still. And so I'm going to inspect the lips. They're not crusted. They're healthy looking, hydrated, no lesions or bumps on them. And then I'm going to inspect the buccal mucosa. So if you could open your mouth. And take your tongue back in. And her teeth and her gums look good. I actually don't have gauze or a depressor, so I'm just going to use my finger. She's my sister, so it's okay. So I'm going to have you open your mouth again. And I'm inspecting the gums and the teeth, and everything looks healthy, no signs of infection. And now I'm going to do assess for cranial nerve 9 and 10. If you could open your mouth and say, ah, stick your tongue out. So her uvula went up in midline. Okay. Now I'm moving on to the neck, and first I'm going to inspect the trachea, which it's in midline, and now I'm going to palpate it. And now I'm going to move on to palpating her thyroid gland with and without a swallow. So, can you swallow for me? Which is good. And now I'm going to move on to palpating her lymph nodes. So first we would start with preauricular. Then we move down to postauricular. And then we would move down to occipital. And then submental, submental, supraclavicular chain, and jugular digastric. And now I'm going to assess your range of motion with your neck. So if you could push on my hand, push towards my hand. Yep. And with the other. Good. And could you go like this? And front and back. Her neck has really good range of motion. And that is it. Now I'm moving on to upper extremities. And I'm going to inspect the skin. Her arms are both symmetrical, they're warm, no signs of rashes or lesions. And now I'm going to assess for a range of motion. So if you put your arms up, and I'm going to pull out, and in. Okay, and then if you could spin your arms around. She has good range of motion. And now I'm going to test for cranial nerve 10 by having her shrug her shoulders. So cranial nerve 10 is intact. Oh, and now I'm going to assess for finger grasp. So if you could squeeze. So I would give her a 5 for both. Now moving on to the thorax and the lungs, and I'm going to inspect her respiratory effort. She doesn't seem to have any horrible effort when she's breathing. She seems to breathe normally. And now I'm going to assess the thorax configuration. So I'm going to put my hands here and have you breathe in and out. And her lungs expanded to when she breathes in and out. And now I'm going to palpate the spinosus process, which is C7, on her spine, which is identified. And now I'm going to move on to auscultating her breath sounds posteriorly and anteriorly. I'm going to start with anteriorly. Breathe in. And now I'm going to move posteriorly. Her breath sounds were clear. There was no adventitious sounds. Done. Now moving on to the heart. And first I'm going to inspect for jugular wave distension, which she has no signs of that. So now I'm going to auscultate the carotid arteries and palpate them. First I'm going to palpate them one at a time. I can feel them both on both sides, so I would say 2+ on both sides, which is symmetrical. And now I'm going to auscultate the carotid arteries one at a time. And I can hear on both sides, so that's good. And now I'm going to move on to palpating the apical impulse, which is found in the midclavicular line in the fifth intercostal space. And now I'm going to auscultate the apical impulse and get a rate and rhythm. So her apical impulse was 60 beats per minute. And now I'm going to move on to auscultating the heart sounds in all four areas with the diaphragm and the bell. First, I'm starting with the diaphragm, which is aortic, pulmonic, tricuspid, and mitral. And no signs of murmurs or adventitious sounds. Now I'm going to use the bell, which is good for murmurs. And I did that in all four quadrants too, as well. And there was no adventitious sounds. Her heart sound was normal. Okay, now I'm moving on to the abdomen. And first I'm going to inspect it for any bumps, lesions, any abnormalities. Her stomach is symmetrical. No bumps, no lesions. Good. And now I'm going to auscultate next in all four quadrants, starting at the right lower quadrant. I heard gurgling, so that is good. She ate and she is nutritioned enough. And now I'm going to move on to palpating the abdomen with light touch to see if I can feel any bumps or abnormalities. Do you feel any pain? No. No bumps or anything like that, no abnormalities. And now I'm going to move on to the femoral pulses, which you can find here, right near your groin. And now I'm going to move on to lower extremities. Now I'm moving on to lower extremities. I'm going to inspect the skin for any abnormalities. No bumps, no lesions, both symmetrical on both sides. Her skin is warm to touch, and now I'm going to assess her posterior tibialis pulse and her dorsalis pedis pulse. So her posterior tibialis is near the ankle, and I'm going to just do them both at the same time. And I would say 2+ on both sides, so they're symmetrical. And now I'm going to move on to the dorsalis pedis, which is near the great toe, and symmetrical on both sides. And now I'm going to assess for any edema on her legs or anything like that. So no swelling, no pitting, edema, or anything like that. Her skin's normal and healthy. Now I'm moving on to range of motion of her lower extremities. So I'm going to have me lift your leg up and hips to the side, and then out, and back down, and then with the right leg, and down. So she has good range of motion in her hips and her knees, and can you twist your ankles for me? And good range of motion in her ankles. Now moving on to a neurological test, and the first test I have for you is a cerebral function of the upper extremities. So if you do finger to the nose, yep, and then heel to shin for lower extremities. Good. Now moving on to neuromuscular, and first I'm going to assess her gait. It's even. She doesn't have any problems with walking or stumbling or anything like that. So now I'm going to assess her strength and coordination first with the shallow knee bend by bending at the knees, which is good. And now I'm going to move on to hops in one place. So if you could hop on one leg in one place and then switch to the other leg. Okay, that's good. And now walk on heels. So walk this way on your heels. And if you could turn around and walk back on your toes. Okay, and then the tandem walk, which is basically the sober walk, if you know what that is. Heel to toe, yeah. Which was good. She has good strength and coordination. And now we're going to move on to assessing range of motion of her spine. So if you could just bend over, touch your toes, and bend up, and go to the side, and go to the other side. So she has good range of motion in her spine. And now we're going to test the Romberg test, which is, if you put your hands out in front of you, close your eyes, and she has good balance, which tests her balance. She fell. She has bad balance, but she has good balance. So that is it. So now I'm going to move on to breast self-exams. And if I was teaching this to a patient, I would tell them to do it on the first month of every single month. That's really important for postmenopausal people because it makes it a lot easier to remember to do it every month if it's just the first of every single month instead of just a random day. And first, I would tell the patient to lie down and start within the armpit and work your way up and down in a zigzag motion all throughout. And then lastly, examine yourself in a mirror to make sure you know what your breast looks like, you know it's normal, and if there wasn't any abnormalities, you could tell and see the difference. So lastly, I would teach about testicular self-exams, which is a TSE, and if I had a male patient, obviously. So I would teach them about TSE, and T stands for timing, which is once a month. And that could be the first day of every month, which is easier for people to remember. And then S stands for shower. So the warm shower kind of relaxes the scrotum, so it's easier to palpate and feel for bumps or any abnormalities. And then E stands for examine. And if you notice any changes, report it immediately to a healthcare worker. And yeah, that's about it. Thank you.